Hello everyone, and thank you for selecting this work for today's presentation. My name is Upal Roy, and I'm from University of Texas, Rio Grande Valley at Brownsville, Texas. Today's presentation is about the tenofovir alafenamide is associated with the shorter telomere length in people living with HIV. As we may all now, HIV and a combination of antiretroviral therapy has changed the scenario of HIV infection. So over the years, we have seen through the treatment, patients are living much longer than before. Along with that, what the recent study shows that there is a recent shifting of the age distribution of people living with HIV or PWH in USA. So based on the current studies in AIDS 2022 shows that there is a current the distribution of the age as they are moving on. Mostly people, more than 50% of the people living with HIV will be 50 years and older. So as these patients are aging with the virus, they are experiencing enormous amount of different age-associated disorder along with this infection, even though they are with antiretroviral therapy. One of them is, as indicated here, the 50% of PWH are experiencing some sort of HIV-associated neurocognitive disorder. So it's a current need, and there was a significant observation have provided that people have a high PWH have a high risk of age-related disorder even with the CART. So how this observation can be measured? HIV-induced premature aging along with the CART. So in this regard, we have adopted the biomarker that can be measured through measure this process through the telomere length measurement. So what we have investigated is that impact of antiretroviral drug tenofovir alafenamide and tenofovir disopraxil fumarate, which is also called as a TDF, and tenofovir alafenamide, which will be referred as a TAF. How these two drugs has changed the telomere length of the PWH over the period of 12 years of follow-up study. So the objective of this presentation or the work is to determine the influence of TAF versus TDF on telomere length in PWH. The study data has been collected from charter cohort from UCSD and many other locations across the country. So 121 patients have been just studied for this particular study who have been assessed between 2003, 2007, and they were reassessed over the period of 12 years to the follow-up of visit for the first visit and the second visit. The telomere length was measured by qPCR from the blood-derived cells. They were analyzed based on telomere data and the beta globulin as a single copy gene with a mixed effect model analysis. The data was further adjusted on the demographic, the disease characteristics, leukocytes counts, and many other while comparing the data between control TDF group and TAF groups. This is the demographic and the different other characteristics that were considered and adjusted during their second visit. As indicated here, the age, gender, ethnicity, education, BMI, and the duration of the HIV infection, and as well as their treatment, was considered as one of the factors. The one factor that I also wanted to identify or bring your attention is that the antiretroviral combination drug that was given at that time was also been considered while we are calculating or we were adjusting our data. Here we are looking at how the TAF is associated with the shorter telomere length among PWH compared to the TDF. Looking at the first telomere data from the first visit to the second visit between TAF, TDF, and other groups, what we have found is that the TAS ratio has changed or has been greatly affected in the TAF population from first visit to the second visit when it was compared among the TDF group and the other group, what was observed is that TAF group was a significant compared to the TDF and other. That's been indicated in these two graphs, as you could just see from the left to the right. So what was the further analysis have shown that, as indicated in this table, is that TAF use was significantly affected the telomere length, which was highly associated with their age, and as well as the duration of the HIV infection, and the combination of other drug that was given to this patient. One of the other drug that was associated along with the TAF and TDF was significantly that was observed was amitriptyline, and as you could see, the p-values also to support that observation. So the result showed that the TA's ratio was definitely significantly changed or declined from the first visit to the second visit, and that too more among the TAF group compared to the TDF group. The other drug that was also analyzed or considered during this analysis was amitriptyline, dolutegravir, lamivudine, abacavir, and duranavir. Overall, the observation shows that among the other than the TAF and TDF, amitriptyline also associated with the TS ratio. However, when we have added the TAF data in that, the significance got weakened. The overall understanding was that the PWH with the TAF had a greater decline in the telomere length compared to those who did not take in the TAF. Among the TAF and the TAF had a higher association with the telomere length compared to the TDF. In this regard, the one limitation of the study was that the patient were analyzed based on their second visit when the TAF was given to these patients. During their first visit, they were not, and they did not have TAF because it was not approved by FDA at that time. With this, I would like to acknowledge the co-authors of this study, and as well as Dr. Lettender, who conducted the study, and the charter cohort where we have collected this data. And I also acknowledge the funding agencies to support this this observation and this study. With this, I'll be happy to take any questions if you have. Thank you so much.